Welcome to Brampton Focus. It's been called a philanthropic milestone, a donation of monumental proportion. $15 million towards Peel Memorial Centre, the brand new hospital to be built in Brampton. Hi, my name is Michael A. Charbon. Next on Brampton Focus, you're going to meet Mr. Phil King, who is the president of the Orlando Corporation, who has put up matching funds to meet $15 million. Also, Miss Ann Ford and Mr. Bob Peacock from the William Osler Health System, right here on Brampton Focus. Welcome back to Brampton Focus. Our focus today is all about the William Osler Health Organization. But more importantly, we want to talk to a gentleman who has made a fundamental difference in the raising of money towards funding this hospital. We'd like to welcome Mr. Phil King, the president of Orlando Corporation, to Brampton Focus. Mr. King, welcome, sir. It's been called a transformational pledge, and one of the single largest gifts to our community. Orlando Corporation has committed to pledge over $15 million towards the William Osler Health System's 3 hospital sites. And part of this unique element is a matching gift, which you're saying you will match up to $15 million, people who put money forward. What motivated you to make such a significant donation to our health system?
Well, Orlando Corporation and Carlo Fidani, our owner, has a long-term emphasis on healthcare for our philanthropic giving. So this isn't the first time that we've given gifts like this. So we really do just concentrate on healthcare. So this was Brampton's turn. They had the need right now. So we decided the time was right for us to provide this gift to Brampton.
Mr. Gibbs, some people would say that establishing a building of hospitals should be the responsibility of our elected officials. That's what we pay taxes for. Is it not the duty of politicians to do this? And what are your thoughts with regards to this perspective of funding healthcare, Orlando Corporation?
Well, our tax dollars don't go as far as they used to. Healthcare has increased in costs over the years, and we have to balance, I guess, the increase in taxes versus providing community support to our hospitals. 80% of our healthcare is provided by the community hospitals, so I don't see really anything wrong with the community putting some dollars forward. It is a challenge. $100 million is a huge burden for a community hospital. The hospitals downtown do get the lion's share of philanthropic giving. So we thought this would be a good start for that $100 million.
So with the estimated budget somewhere around $100 million in a multi-year campaign, what's been the response so far of donations?
Well, the project cost is considerably more than $100 million. The $100 million is just the community share, and that goes towards funding the equipment and that inside the building. I mean, the buildings are funded by the government and the ongoing operations are funded by the government, but this is just the local share. So, by us putting up the $15 million, we'll make 30. We think that's a pretty good start to that goal. Your
challenge is such a significant gift. It's been called a game changer in many instances, and it really exemplifies philanthropic fundraising, and it really inspires people to donate. How do you feel about someone making a statement about what you've created, philanthropic, game-changing?
Well, obviously it makes us feel great. It was what we intended. A game changer, yes. We've done this before. We've made it, I wouldn't say easy for a foundation to raise money. It makes them better. They've got to stretch for this. So we've put the time frame in place, and it's working. It's worked in the past. It's working this time. We've seen companies that match their employee contribution. So that has $1 equals 2, and then with our match, that 2 makes it 4. So that sort of thing works, and we've heard from the foundation that people are coming forward, putting money to this that would not have done so if we hadn't have made this matching gift. So that's exciting for us and for the foundation.
what kind of predicament would we have been in the region of Peel, specifically in Brampton, if it was not for Orlando Corporation's philanthropic gift?
What predicament? Well, it's obviously, if we didn't come forward, I'm sure there will be others that came forward. It's a large community, and you know, I've got confidence that they'll achieve this. We're just helping in that regard. And it isn't me, it's Orlando and it's Carlo. Carlo Finani is the owner of this company, so they're the corporation, and Carlo are the ones that have sort of put this thing forward.
So what would you like the legacy of Orlando Corporation to be as a result of this once the project is getting close to completion? Is there something that you would like to see emblazoned with regards to William Osler and Orlando? We're not looking for a legacy. What we'd like to do is make a difference. And as I said earlier, we're challenging the foundation it's very difficult for them to get this money, and they've got to work hard. We want them to do things differently. We want maybe to run the foundation or the fundraising more as a business. We want collaboration between departments. How do we do more with less without sacrificing the healthcare? So if we can achieve all of those, that's really what we're looking for. It's not about our legacy at all. Mr. Phil King, President of Orlando Corporation, thank you so much for joining us today on Brampton Focus. Well, there you have it, folks. I mean, you talk about someone who's putting their foot forward for our community, Orlando Corporation, and Mr. King being the president, putting a huge effort into getting the William Osler 3 sites up and going. Coming up next in our next segment, we're going to meet Mr. Bob Peacock, who is the director of William Osler Health Foundation, and also Miss Ann Ford, who is the joint vice president of facilities and redevelopment. My name is Michael A. Charbon. You're watching Brampton Focus. Back with more on William Osler Health right after this. And welcome back to Brampton Focus. Our topic today is the William Osler Health Organization, and we had the opportunity to speak to Mr. King, who was the president of Orlando Corporation. And as we talked about in segment number 1, $15 million put up to fund this hospital and a matching gift. But more importantly, we wanted to talk to the people who are responsible for making this a reality. So we're welcoming right beside me Miss Ann Ford, who is the joint vice president of facilities and redevelopment for the William Osler Health System, and also Mr. Bob Peacock, who is the director of the William Osler Health Foundation, board and chair for the Peel Regional Capital Campaign. Folks, thank you so much for joining us on Brampton Focus. Really wonderful what you're doing. You're really adding to the fabric of our community, and we wanted to bring you here and talk a little bit more. How long has this project been in development for now?
Well, the construction itself has been in development for about 2 years. It started in June of 2014. But prior to that, we had a lengthy couple-year, 3-year process of planning and approvals through the Ministry of Health before we could actually get to construction.
So where is it, for those who don't know, where is it actually located? I mean, everybody's aware of Brampton Civic, which is a full-service hospital. This is another leg. This is a different type of service. Where is this located in our footprint? Right,
so the new Peel Memorial is actually a brand new hospital in Brampton. It's in downtown Brampton, right off of Lynch and John Street. It's actually being constructed on the old Peel Memorial Hospital site.
Cool, so accessible by transit and accessible to everybody who wishes to go there. Give us an idea of the footprint. What kind of a size are we talking here with this facility?
Sure. The building itself is about 350,000 square feet. So we have 3 stories of clinical services and then 2.5 stories of underground parking, along with some surface parking. So it's a large facility. When you compare that to the services that Brampton Civic is, I mean, we can see pictures of the construction as it's happening right now. What kind of services are we anticipating from this facility? Well, at Peel Memorial, it's a little bit different from Brampton Civic because it is a purpose-built outpatient facility. So what that means actually is if someone is having a day procedure, they can come in the morning and they'll go home that same afternoon. Same with all the clinic visits. There will be no overnight hospital stays at Peel Memorial. So if you have an emergency, you're not going to this facility, at least in this stage? It depends on the level of your emergency. So as we like to say, if you're actually truly having an emergency, to dial 911 first.
Right.
But at the Urgent Care Center at Peel, we will be open for more than 12 hours a day, 16 hours a day, and we will provide services for what we call non-life-threatening situations, so fractures, bad stomach aches and that sort of thing. However, we do have the capacity within the Urgent Care Center to take care of someone if they were to happen to arrive at the facility, let's say they might be having a heart attack. We actually will be able to take care of them, stabilize that patient, and then transport them over to Brampton Civic.
So this is really a phase one. This is the establishment of this footprint, supplying day services, if you wish. But there is a phase two and a phase three, and eventually we will see something along the lines of Brampton Civic. Is that correct?
Correct, to a point. So we have a master plan, as you mentioned. It has multiple phases in the planning, and we do have a phase two. The phase two project will be some sort of inpatient overnight stay. We're not sure exactly what those beds will be right now. In our master plan, we've talked about beds such as rehabilitation beds, potentially palliative beds, those sorts of things. So when we get to phase two, we will have overnight stay, and then in that case, phase one, the services in phase one will support the programs going into phase two.
And when we talk about funding, I mean, we had the opportunity to speak to Mr. King from the Orlando Group, who's put up matching funds of $15 million. And one of the questions that I asked Mr. King, is it not the responsibility of our elected officials, both federal and provincial governments, to supply the funding for these kind of projects? And it's I mean, it's a wonderful thing that Orlando has participated in this, but where else is the funding coming from? What is a portion that is coming from our political officials?
Well, actually, we get the majority of the funding for these projects from the provincial government. So the Ministry of Health funds construction projects, 90% of what we call hard construction, so the actual building, the metal, the steel, the concrete. And then they so the hospitals in the community then need to provide what's called a local share, so 10% of the hard construction costs. The issue we run into is that the Ministry of Health actually doesn't then pay for any of the equipment or furnishings to go in the building. So that's where we run into needing to ask our communities to help support equipment such as our CT machine or wheelchairs, or even the reception desks that we're putting in. So furniture and equipment are not funded by the Ministry of Health.
There have been some community groups who say that Brampton is getting the short end of the stick. We should not have gotten a preliminary hospital or outpatient care facility like this. We should have gotten another Brampton Civic. Whereas others say we should be grateful to get what we have and be able to take the opportunity to build another phase. How would you react to those two perspectives?
Well, in reality, the way medical care has gone and the way the models of care within the hospital they're shifting to an outpatient basis. So even at Brampton Civic, the majority of our surgeries are done on an outpatient basis. I would say almost 65% of our surgeries are done on an outpatient basis. So that's the way the models of care have gone. The other concept around Peel Memorial is really about health and wellness. So we are actually trying to help our community, our patients, stay well, or if they have a chronic disease, to actually help them monitor and maintain their health rather than having to go to an emergency department or actually have an inpatient stay. We do have research that shows in an elderly population that if an elderly patient comes to the emergency room, it only takes hours before they actually start to decompensate, as it's called, actually start to get worse than they are before. So if we can help keep those folks and all of our patients out of an emergency room, it's actually bettering the population health of the community. So we believe that Peel Memorial is actually a really great addition to our service. So if you do have a very extensive disease process or you do have a heart attack, we have those high acute services that can take care of you in that moment. But then as we help you get back into the normal daily life and things that you need to do within your life, you can actually attend Peel Memorial and we'll help you through that. We've got some rehabilitation services. We have our cardiac diagnostics. So we're trying to keep people healthy and keep them out of the acute hospitals.
So with just under a minute left, we want to, in our next segment, we want to talk a little bit about the Orlando Corporation's matching funds, because we want to be able to raise funds and raise awareness, and we want to be able to engage our audience both in Brampton and the Peel region at large to participate in this. So when we come back, we're going to talk a little bit more about the Orlando group and drill down in our last segment. We want to find out a little more about the potential of Phase 2 and find out where we're going to be. We're talking about William Osler Health. My name is Michael A. Charbon. We'll be back with Brampton Focus and more information about this you need to know right after this message. And welcome back to Brampton Focus, our final segment. Our topic today and our focus is all about the Peel Memorial Centre, which is part of the William Osler Health System. And joining me today is Miss Ann Ford, who's a Joint Vice President of Facilities and Redevelopment for the William Osler Health System, and Mr. Bob Peacock, who is the Director of the William Osler Health Foundation. In our first segment, we talked to Mr. Phil King, who was the President of Orlando Corporation. As you know, they put up $15 million in matching funds to help raise money for this hospital. And in this, our final segment, we want to drill down a little bit and find out some more about how you can become involved and assist in contributing money so that we can be able to utilize that wonderful $15 million donation. Bob, I'm going to go to you on this. $15 million is a huge donation. It's been called a monumental philanthropic effort. How is it going getting money now?
It's going very well. We've got a lot of work still to do, and the Orlando contribution, the Orlando match, has been wonderful for a couple of reasons. Obviously, getting a significant amount of money towards the cause is important, but the beautiful thing about this is it's a matching gift. So it's not like they just wrote us a check and said, okay, here you go, and the community says, oh, well, there's a lot of money, so we must be done. We have to match that. And that's the beauty of it. It's going well. There's a number of people and organizations who have said, hey, if Orlando believes in this, then I'm going to believe in this, and I want to be part of that. So it's been very helpful.
There's 11,000 things, and I know that sounds ambiguous, but there's 11,000 elements that need to be contributed, need to be part of this hospital. And we were talking about X-ray, diagnostic, dialysis, CT scanners. There's so many elements that need to be put into this facility. How can someone at home say, well, how can I make a difference? How can they help to get those elements?
And anything that's donated will go towards the 10% that the community must pay towards the building costs and the 100% that we must raise for the equipment. So how can someone at home get involved? They can approach the hospital, the foundation. There is a website, oslerfoundation.org. And anyone that's involved with the foundation of the hospital would be delighted to point you in the right direction and gratefully take your money.
Now, Orlando has pledged a maximum of $15 million of matching funds, as we said. So the more money that the community puts together or community raises or social groups raise, they will match that up to the amount of $15 million. But people can also, they can will a gift. They can do drives, community events. What are some of the initiatives that the public can consider? I mean, the fabric of a hospital helps us all. I mean,
yeah, there's a number of things that organizations have done. Some have, in one case, a law firm in Brampton, instead of sending Christmas cards and Christmas gifts, they raised money to go towards the hospital. Other organizations have done bowl-a-thons, runs, other activities that bring the community together, or a company bring their employees together to have some fun and raise some money, and all of that will be matched by Orlando.
Interesting, left in many other fundraising efforts, there have been companies who have said, we're going to buy an X-ray machine, or we're going to buy a dialysis machine. We're hoping that we can challenge the folks out there in Brampton to see if there are some companies that will say, okay, we're going to do an X-ray machine. Being more specific to a piece of equipment, does that seem to generate more interest if you have that one singular goal for what your corporation or what your funding purpose is?
Certainly for some people and some organizations, being able to say, we funded, we bought this piece of equipment. And there are naming opportunities as well for certain cases where if someone buys a specific piece of equipment or furnishes a specific room, that they can be attached to that room or that equipment. You know, in our case, our business, we made a donation to Brampton Civic a number of years ago, and one of our employees was in visiting his niece who was in the hospital, and he said, you know, when I walked in the room, I saw her name on the outside of the room, and I felt so good about that. And you know, that feeling of goodwill is really important, as well as the ability to raise some money for the hospital.
Well, a founders club, I mean, that's one of the things, or people who have been involved at the actual foundation of making it happen is so critical. So let's talk about cash here. Where are we at? How close are we in being able to get to that 15 million maximum matching? What's our deadline date, and what kind of targets do we have to hit?
Sure. The 15 million is actually divided amongst the 3 Osler facilities. So 5 million is allocated towards Peel, and then 5 million for Brampton Civic. And the time frame for the Peel match goes until the end of June this year, June of 2016. So we have just over 3 months left. We're doing well on it. We still have room to go. And our goal is to have the full fundraising for the whole hospital done by about this time next year. That's my personal goal, is to have it all done soon after the hospital opens. And we've made some great strides. There have been many generous donors, but the job is not done. There's still lots of room, and we'd welcome any and all who want to be part of this.
And as they say, a hospital really services everybody. It's the most wonderful place that you never want to go to, is what they say, because when you go there, but healthcare is such a huge part of the fabric of our community. And a final word from you to our folks at home to try and get them to understand how important funding this hospital is, and how it is a responsibility of all of us to participate in this for the will and the best of our community.
Well, again, I think Peel Memorial is about every age group, every demographic that we have in the city of Brampton and the surrounding area. So it's a brand new hospital. It's something that's coming to Brampton to help everyone maintain their health over time. And we'd love to have everyone participate. And we really look forward to opening the facility to all of the citizens of Brampton. Even if you're not there for care, come by and we'll have a cup of coffee.
And when can we look at phase 1 opening? Do we have a hit date?
We're looking at about this time next year to have all of our services up and running. Right? 2017. We do have a time when we'll actually get the keys, but it does take us a few months to get all of our equipment in, training and orientation. So about a year from now.
Beautiful, thank you. Miss Ann Ford, who's the Joint Vice President of Facilities and Redevelopment for the William Osler Health Care System, and also Mr. Bob Peacock, who's the Director of William Osler Health Foundation. Also like to thank Mr. King, Phil King, the President of Orlando Corporation, for their wonderful donation of matching funds. We encourage you here at Brampton Focus to participate, put together a run, motivate your company, sponsor an x-ray machine, a CT scanner, a dialysis, whatever. Participate, because you never know when you need it is when it has to be there. My name is Michael A. Charbon. Thank you for watching. Look forward to seeing you again on Brampton Focus.